Over the series, you're going to be hearing from many people. And we'll hear about how their work is shaping the future of health, education, and well-being. Our transformative work has improved not just hundreds or thousands, but millions of people around the world, from our neighborhoods to across the globe. We do this through critical, cutting-edge research, innovative educational programs, and most importantly, human-centered care. Today's conversation will begin. This is the first one with, of course, our members of our leadership team. And they're here to reflect on how we as a school, how we are doing and where we are going. Rather than a formal presentation, we thought we'd have a panel. And I'll be asking questions. And then we may have time for also asking questions from, I'm being asked to move over here to get in camera, from you all in the audience. So I'm thrilled to have you all here today. And I'm thrilled to have the leadership behind me share their perspectives on what they do and how they do it. And then their perspectives on how we're going to lead in the future. It's a very important time in nursing, as we all know. So let's begin. Each of you, it's very nice to have you in front of everybody. Each of you sit at the intersection of leadership, innovation, and education. And you're all shaping what nursing means today. So Sue, I'm going to ask each one of you some questions, but Sue, I'm going to start with you. Would you start us off by briefly introducing yourself and sharing for 2 to 3 minutes on how your leadership and research focuses on innovation? We always talk about how important innovation is at school. And as you think about the work across the school, where you see Columbia Nursing already leading in research, and where you think we need to stretch a little bit more.
Thanks. I've been at Columbia 25 and a half years. I came to, and I became the alumni professor of nursing about 24 years ago. I came to Columbia with a vision to do 2 things. One was to have this be the best place in the world for nurse scientists to learn interdisciplinary informatics methods. So I wanted to be #1 in the world. The second thing that I wanted to do was to really promote informatics competencies for nurses and advanced practice nurses. And I wanted that to be a real attribute of the Columbia Nursing graduates. When I arrived in 2000, we already had strength in infection control with Elaine Larson was already here, and we have strength in health policy, and we did have some strength in HIV. So I really brought in that informatics thread and added that innovation. Through the years, I'm currently the Vice Dean for Research, and when I came to Columbia in 2000, we were number 33 in NIH ranking, and everyone's pretty aware that we've been #1 for a few years. It took more than 20 years to get that. And that was a combination of not only success of the existing people in securing NIH funding, but also very strategic investment on the part of the school in building infrastructure for research in general, as well as hiring and retaining faculty. Where do we need to go in terms of growth? Well, as it turns out, human-centered AI is going to be a strategic priority of the university. So we're already there. We have 25 years of experience in that. One of the other areas which we have very targeted expertise in the school is in the area of exposomics, which considers the environment with other types of exposures. And that is a growth opportunity within the school, but a strategic priority for Columbia moving forward. I think one of the other ways that we really need to grow is we have predominantly been very dependent upon federal research dollars. So we really need to think about more industry collaborations, more private foundations and other types of research funds. So we're less at risk when changes occur at the federal level.
Well, thank you. Thank you for that. Yeah, lots of changes going on. She's weathered many a storm in the past, months and been like years. So, okay, Mary, the next question is for you, and it's a wonderful question. First of all, introduce yourself. Then, what is your perspective on what the Columbia nursing graduate of the future will look like? Question. And how are we reimagining our curriculum to prepare for students for leadership across diverse settings? And with that, could you touch on the new MDE and DNP programs that will allow our students to be more flexible in their schedules?
Sure. And thank you for all coming to hear these where we are in the school. So I'm Mary Hickey. I'm the Vice Dean for Education. I'm coming up on my 2-year anniversary here at Columbia. And it is a phenomenal place to be. Tremendous resources to really help us prepare the next generation of nurse clinicians. So the nursing graduate from Columbia of the future, what does that look like? Those graduates will be clinically excellent and technologically fluent. So what I mean by that is they will have mastered foundational clinical skills to provide care to patients while leveraging emerging technologies to promote that care. They will be human-centered and equity-driven. So despite the advances in technology, we need to remain focused on the human aspects of care, focusing on the patient, on cultural humility, also on equity and access. So they will be advocates for that. They will be adaptive learners and innovators who will not only work in complex health systems, but will have the tools to transform those systems to improve access, improve outcomes for patients and communities across the spectrum. I consider the graduate of the future to be a bridge between science, technology, and humanity, ensuring that the patient remains at the core of what we do.
Thank you. Thank you.
So how are we going to get there? Some of the programs that we have and that are emerging here. We've been implementing a variety of curricular changes and to meet some changes at the national level, but also to meet what's expected for the new practice-ready graduate. We have new part-time programs to help students balance. You know, the student of today is a little bit different than they were when I went to school. Students have multiple competing responsibilities, so we're giving them opportunities for part-time programs. They can balance work and school. And then when they're ready to come back to graduate education for their NP, their DNP, or some other new programs that we're designing, we're creating part-time options for them as well. So they can remain engaged at the bedside or in the clinical environment while they come back to school. So we're not fully draining that healthcare system. Students are gaining that experience while continuing to advance their careers. So we have hybrid MDEs, part-time MDEs for that entry into practice, and then part-time DNP options. One of the most innovative things that I do think we're creating is a systems leadership DNP, where we are leveraging the tremendous expertise that we have here at Columbia. Dr. Bakken and I are working together on building a concentration in human-centered AI and informatics. Within that, we're working with Dr. Peslinski in SIM to integrate competency-based education, AI, and technology across our programs. So again, just building on the expertise we have here to prepare practice-ready graduates.
And also with the School of Engineering.
Correct.
Working a little bit across the spectrum, across the schools. So Natalie, You're even newer than me. Tell us a little bit about your role here at Nursing and the acceleration of technology in the SIM Center. And how are these changing the way our students learn? And I think more than anyone else, my question to you is, how do we keep the human aspect of the patient as we work through SIM technology?
Sure, thank you. Good afternoon, everybody. So I have been here for just a little bit over a year, and I currently lead the Helene Fold Simulation Center, where we utilize immersive technology to prepare students for complex real-world care. Now, over the years, simulation has shifted from task trainers to mannequin-based education to including standardized patients. And now we're shifting towards virtual NI and AI enhanced tools. We recently developed AI agents that are not just reactive, but they are interactive with our students, giving our students the opportunity to make clinical decisions in a timely manner. And not only that, but to reflect on those decisions in real time. These AI agents additionally give feedback to our students, and that feedback is individualized based on the voice activation mechanism that is used. So every student gets a specialized, tailored sort of experience. These virtual patients, I think, will help students make critical decisions about their priorities and ethics in care. And I think that what's remarkable is that even though as we use technology and the technology advances, we have to stay focused on the people. The best simulations are not about, mannequins. It's about the debrief, the conversations, and the reflections of students on their actions in a safe clinical environment, right? And how does that translate to patient care? We make sure students don't just learn how to do procedures, but how to communicate with empathy, manage conflict, and critically think under pressure, and to know why they're making that certain decision for this patient at this particular time. So in other words, technology amplifies humanity when it's used intentionally. And the mission of our Clinical Simulation Learning Center is to make innovation deeply human.
And if you want to see more of that, she's going to take you and let you see that this afternoon. So, Jane, you are our newest member of the leadership team, but you've been at Columbia for a long time. So, introduce yourself on the clinical side, talk about new models or partnerships that are shaping how we prepare our students for.
Sure, gladly. Good afternoon, everyone. My name is Jane Chidovit. I am an adult gerontology, doctorally prepared nurse practitioner, and a proud alumni of the school itself, having completed the ETP program, the master's program, and the DNP program here. And so I can really say that I'm a true output of the school. And that really, I'm very proud to say that.
A great example.
Yeah. And as an alumni here, I have been the clinical lead provider at our faculty practice a block away, at our primary care practice for the last 8 years. And most recently, as of 2 months ago, have been able to take on the role of overseeing the clinical practice operations as assistant dean of clinical affairs. And for those of you who don't know too much about our practice, it's a predominantly primary care practice that provides comprehensive care to adults ages 18 and over within the community and beyond. We have the privilege of being a clinical site for our students. So this is really where our students are able to connect all the things that they have learned through the school into real life practice when they rotate through with us. We are able to host students from multiple disciplines, including the midwifery program, the psych mental health nurse practitioner program, as well as the family nurse practitioner program. And we also partner with the School of Social Work and occasionally host social work interns as well. I say this because I think it's really important for us to have this interdisciplinary learning environment for our students, and it exposes students to collaborative care that integrates multiple multiple perspectives and areas of expertise. And through the mentorship of our clinical preceptors and the collaboration with their own peers across specialties, students gain a deeper understanding of holistic patient-centered care and preparing them to deliver coordinated, high-quality healthcare in their future practice. Also in my role, I aim to strengthen our relationship with the departments across the medical center here at CYMC. There are over 400 nurse practitioners who are employed at Columbia Doctors alone, does not include NYP. And although there are many differences in terms of the role of the nurse practitioner in each department, one thing that each department does share in common is their inability to recruit, retain, and hire good nurse practitioners. And so it's constant feedback that I've heard from the NPs at the medical center alone, but also from the leadership team as well. And so we're working closely with each department to figure out how the School of Nursing can bridge this a little bit better by developing potential fellowship-like programs that can really create a direct-to-practice program for our students in the future and thus help with retention and as well as improving access to care and quality of care.
I was with one of the clinicians across the street this morning who was just in dire straits because she wanted a nurse practitioner, and they think if they talk to the dean that we can get them one, right? Really, it's a big issue. So thank you for your work in that. So this series centers on the theme health and humanity. The next question is for you, Mary and Jane, and you each have 2 minutes to respond. And this is an interesting question. Health and humanity, what does that mean to you personally? And how do you lead with humanity in your work, especially during times of uncertainty and change? Mary, we'll start with you.
So first and foremost, I am a nurse. So I'm an educator here, but as a nurse, I would say health and humanity to me means always putting the patient first. And that's what drives my approach. And I say patient, but to me, that's a broad term. So whether it's the patient, the person, the student, just what's important to that person in that moment in time, and how can I facilitate that, promote that? And I think nursing values really ground how I approach my work, again, as a clinician or as an educator or as an administrator. Honesty, integrity, compassion, respect. Just keeping that at the forefront of my mind in all of my interactions. We are in uncertain times. Times are very challenging. But for me, I try to quiet that noise and go back to that central mission, that central purpose. Why am I here? And what am I doing? And I'm here for the patient, for the community, for the profession, and just keeping that as my center.
Jane, health and humanity means treating healthcare as more than just treating an illness or a condition. It really means about caring for the person as a whole. It calls for compassion, empathy, and integrity in every interaction, recognizing the dignity and vulnerability that come with needing medical care. I strive to lead with humanity as a nurse, especially during times of uncertainty or change, through multiple practices. One being empathetic communication, really listening to the patient, actively listening, prioritizing clear, honest, and frequent communication, and addressing concerns with empathy and sharing information transparently, even if the message may be difficult. I try to involve patients in their medical decisions as much as possible, because ultimately these decisions affect them. And this also honors their individuality and ensures that every voice is heard and respected. I also try to create really a safe environment for patients to feel safe, to express challenges, to seek help and support one another. This includes advocating for emotional and well-being and recognizing the strain that change can really cause and bring. And ultimately, I try to ground everything in fairness, compassion, and well-being of both patients and my colleagues, never losing sight of the human element amid operational demands and financial demands too, which can be very tough to balance.
It's a tough time to leave, for sure. Sue, the next question is for you, and this is quite a question. What do you think nursing leadership will look like in 10 years across academics, systems, and policy? And what are some examples of how our school's research has a tangible impact on patient care, community health, or health policy?
Thanks. And one of the things I would add to that is it's important that we think about industry as well when we think about settings for nursing leadership. So I feel no matter where it is that transformational nursing leadership needs to be evidence-based. People need to be phenomenal communicators. They need to be not only interprofessional, but interdisciplinary as we work with engineers and computer scientists and people from professions quite different from our own with different types of skill sets. And when we look at the impact of the research in the school, I'll give a few examples. 3 graduates of our PhD program, Sarah Collins-Rossetti, Ken Cato, and Patty Dykes have recently finished a study called Concern that is the first real-world evidence of the power of nursing surveillance and its impact on patient outcomes. In this particular study, they use AI to look at patterns of nursing documentation, increased documentation, unusual times of documentation, and use that to predict patients' risk of clinical deterioration. They put that into a user interface, the Epic EHR patient list, as a situational awareness intervention. And that particular study across both Harvard and Columbia sites shows a decrease of more than 30% decrease in mortality risk, a decrease in length of stay, an increase in appropriate admissions to ICU. So we all know as nurses that surveillance is an incredible, powerful intervention, but this is real quantitative evidence that others are going to believe, and it's out as a preprint now, but it will be in Nature Medicine in the June issue. We've had tremendous impact of the researchers in our school on policy, thinking with our various researchers who work in this particular area, work by Pat Stone, Jingjing Chang, and Elaine Larson have influenced infection control policy at the Centers for Disease Control and Prevention, and also at the World Health Organization. We have investigators, including Ruth Masterson-Krieber and Billy Caceres, who have led position papers from for the American Heart Association that have influenced care in that area. We have Greg Alexander, who has really looked at HIT maturity and the influence of that on quality of care in long-term care settings. So it's very important. We have numerous examples, and we really work through our centers of excellence and our center, including the Center for Health Policy, on helping to support researchers to get their research both into practice, but also into policy.
Yeah, I can't imagine what healthcare would be today if we didn't have the nursing research that we've had in years past. And it's important that we all know that, we're under attack, on nursing research, nursing faculty, and we have to always make sure that we keep this emphasis on the importance of research for the patient from the nurse perspective. So thank you, Sue. Okay. This, now I've lost my spot because I want to make sure that we get all of our people included. Natalia. We knew you were next. We'd love to hear your thoughts as well. What do you hope our students, when they leave, will carry them with them? Will carry with them, not just as nurses, but as people. And you touched a little bit on technology and how we're going forward, but what do you think they'll take with them when they graduate, from your perspective?
Great question. So 4 particular words come to mind, which is curiosity, courage, compassion, and accuracy. Curiosity to keep asking questions, even though sometimes they think they know it all, but we all know that learning is a lifelong process and you don't know it all. So have the curiosity to ask those questions. Courage to speak up for patients and themselves when patients are not able to, or when the systems that they work in don't make it as easy, right? Or there's no direct path. Compassion, right? Compassion, not just some kind of buzzword, oh, nurses are compassionate and should have compassion, but to truly practice compassion as a discipline on a daily basis and to truly listen to their patients, hear what is important for them in their own health and how to navigate the various complex systems that we currently have. And patient advocacy, I've seen from my own experience, and I'm sure you all have as well, that many times patients just slip through the cracks, right? They don't have that, not everybody has a nurse as their family member or somebody in the medical field as, in their corner, and simply don't know what the right questions to ask or what should they be thinking about, or hear all this medical jargon and so much information coming at them, right? So how to decipher and kind of plan for the future and for a path of wellness. And I think our graduates must be a voice for patients when they can't advocate for themselves. And at Columbia, we're preparing clinicians for a changing healthcare landscape. It is ever changing, and it's changing quite fast, especially with all the new emerging technology. But at the heart, we're preparing human beings to bring steadiness and empathy into moments of vulnerability. And I think if our students lead with that and leave here with those, with that mindset, I think that they will be ready to handle anything.
So you hear the we've been dealing with this for quite a long time, and actually this is very gentle compared to what standing. So please bear with us, and I hope online it doesn't interfere with what you're hearing from us. So we have one last question from all of you all, and I have time to answer this. So we have a wonderful audience online and facing us. We have, as I said, alums, we have donors, we have board members, we have faculty. So this question is for you to think about the context that we're in today. And each one of you can answer this question. How can we foster engagement with our alumni, students, faculty, and partners to join you in advancing the mission and the vision that you have expressed and the dreams that you have for the school? How can you bring everybody to that table? And we're going to go backwards this time. Jane, can we start with you?
Absolutely. Well, from a clinical standpoint, I think it's just so important for our board members and our donors and everyone to really understand the impact that we're having on our patients. Our patients, especially within the community, really look to us at the practice for their primary care. And they really respect the care that we provide, and they trust us, and they come back to us. And I've had patients who've been with me for the last 8 years or even beyond when I was a student who started off being there and who have followed me throughout this practice. And I would love to share the stories of how I improved my patients' A1C, got them to lose a couple pounds or improve their blood pressure and cardiovascular risk and avoided cardiothoracic surgery for them. I would love to share the stories a little bit more often about the impact that we're having in the health of our community in general as well. How we are improving cancer screening rates within the Washington Heights area, not only the medical center, but the surrounding neighborhood for our underserved population. So I welcome to talk to you about these stories and to potentially introduce you to my patients who would be willing to share the impact of our practice that has had on you, and to really show to you that we are making really worthwhile, transformative changes in the way that we look at our patients and how they take care of themselves.
And yes, and you can encourage people to come to the clinic. I've had my healthcare for 8 years there, and it's really pretty amazing. You get really care when you need it. You don't have to. They're accessible and available, and really give top quality care. So, Natalia.
I would love for our alumni to come and visit our simulation center to show them how much it has grown to where when they used to go to school, right, what they had available to, time lapse to what is available now, right? And how the students are actually utilizing all these technologies and how they're working together and how we have interprofessional simulations and how, all the building blocks sort of come together. I think it's important for our students to learn from alumni. I think that, Jane mentioned about storytelling. I think that storytelling is a powerful tool to share and learn from one another. And, perhaps our alumni could potentially mentor some of our students and show them, what are the different paths that are available and share their deep knowledge of nursing to somebody who maybe doesn't know which path to take or isn't sure, or maybe doesn't have that support system at home behind them. So I think that connection, the more connection we have, I think the stronger the relationship and partnership is.
Right. Yeah. So how can they keep up with what's going on that's new?
Well, we could do tours. We could do short interactive, video sessions, short little kind of conferences. It doesn't have to be long. It doesn't have to be, too frequent. Everybody is busy, but just to kind of stay in touch, right? Almost kind of having like a series of, simulation events that we touch on different aspects of simulation education and share with our alums.
Okay. Mary.
And we can build on that together. I have a student advisory group of different levels that we can blend that student advisory group with our alumni organization and have collaborative meetings and opportunities for those groups of people to come together. We're doing more with engaging our clinical partners to find out what's needed by them in the clinical arena, putting together those types of groups of people to say what's going on in your world and how can we meet those needs, what's important to you, and then just finding opportunities to put them together. But bridging students, alumni through a sim event, through a different coordinated event that people can connect so that there's an opportunity to share ideas and information.
Good.
Yes, within the research division, we have 5 centers of excellence. We have the Center for Health Policy, we have the Center for Healthcare Delivery Research and Innovation, we have the Center for Sexual and Gender Minority Health Research, we have the Center for Community Engaged Health Informatics and Data Science, and we have the Center for Research on People of Color. Faculty and students are always already engaged to a certain extent, but talking to each of those center directors, we have 2 of them in the room. Tonda Hughes is here from the SGM Center. Ruth Masterson-Krieber is here from the Center for Community Engaged Health Informatics and Data Science, about thinking what might be other avenues of engaging with those various audiences. And I also think about it from the some of the things we do overall through some of our structures that we have within the school. And that is really trying to get key actionable insights from our research out to various audiences that could include the ones that you've listed, but we think very much about not only how do we turn research results to research participants, but also to clinicians who may have participated in the study, to community members and other folks interested in it, as well as policymakers. So that, and I'll just tell you, I recently finished a 2-year, this is not only important for many reasons, but this level of engagement, I think, will more and more become a new standard for research. I just finished 2 years co-chairing a group at the National Institutes of Health that was focused on community engagement in research. And throughout this, I think, and one of the things, and this ties back to the theme of humanity, is really recognizing all the voices that are important and making sure we get those voices into our research, into our education, into our policies, and coming up with the strategies that enable the broad swath of voices that we're interested in getting engaged throughout the aspects of our mission.
Okay, thank you for that. You know, when you think about nursing today, they're still, they're needed all over the country, right? And nursing faculty. We're having a shortage of nursing faculty, and that will continue on. I'm looking at people here that not saying anything, that are going to be retiring. And that's going to be happening more and more. And we need new nursing faculty. And we need really support for schools of nursing that do research and that are based on academic integrity and have programs that challenge them. I'm looking at you, Heidi, and you're always talking about the rigor of our program and how important that is. And so the schools like ours, you know, there are schools across the country, they're starting up for profit, all kinds of schools, but how important schools like this school become more and more in this environment. Nursing research, you know, will there be an NINR? We don't know that, but we know that the majority of the time the patient spends is not in diagnostics and, you know, in interventions, but it's long-term in how they manage their life. And I'm looking at you, Ruth, and thinking about how you complement cardiovascular disease in that respect. But all the things that we have done, it just gives me chills. We must continue what we're doing. And so we want to show you all our dreams, what we're accomplishing. And we also want to engage with you and whoever's on, and I hope you can hear us virtually. And now I'm going to open it up for questions from you all to ask. You've heard from us. What stood out from you, for you in this conversation? And what question would you ask that I haven't asked our leaders or me? What questions do you have? Don't be shy. Okay.
One question that you always ask is, why Columbia? Why would people pay the tuition to come to here?
Yeah.
There's other less expensive options.
And that's a great question. So in case you didn't hear that, the question is, why Columbia? We talk about that frequently as the leadership team and faculty. Why Columbia? This is an example right here on this podium, these panels. We have the most amazing faculty. Our faculty are well published. They're influencing. They're not just innovative. So we always say there are two I's that are important to us. Innovation, which is very, very difficult, but also how do we influence? And so it doesn't matter that we have best of anything. What matters is, are we influencing that across the globe, across New York, across the United States? And we have done a very good job of that. So if you are thinking of coming to a school of nursing and students don't think about that, it's all about the faculty. It's about the faculty. And when we have, and I've been at many schools, we have the most amazing, professional, dedicated faculty that I have ever seen. And that's a reason to come to Columbia. And the other reason is we are tied, you've heard, we're tied to the School of Engineering. We're going to have that piece in our DNP program, our new program. We're tied to journalism. We had a meeting today. How do we make that easier? How do we bring more of those classes to our students? So you not only become a student at the School of Nursing, but you have the ability to also access other classes and hopefully other resources, other professors. And so Columbia is also, to me, which I love about it, it is not bordered by any state. And Tanda, I cannot say this with you asking the question. I cannot not include this. We're not about the United States either. We're global, and you help build that program. And so if you want a global insight, come to Columbia. If you want a global experience, come to Columbia. If you want to change the lens of how you see humanity, come to Columbia, because that's what you'll take with you. And Natalia, you were talking about, what do you graduate? Who do you become when you leave? And if you want to become a lifelong learner, come to Columbia. We're looking at programs where we can continue to engage our alumni and to continue to help them forward. And I'm not a panel member and I'm talking too much. What's the next question? Think about other questions you might ask. Any online?
So we just heard from someone on Zoom, and she said that she would like to address the internal difficulties that providers have that are keeping them from reaching this level of performance.
Okay, that would probably be for Jane.
Yes.
And did you hear the question?
Can you repeat it?
Yeah, we'll
Of
take
course
the
I can.
question.
She would like to address the internal difficulties that providers have that keep them from reaching their highest level of performance.
So that answer is multifaceted, and there's multiple different. And if we're speaking about providers in terms of nurse practitioners specifically, in the medical center, the nurse practitioners, their scope of practice is so wide in range. And thankfully, in New York State, we can practice to full authority. We're extremely autonomous. However, does that actually translate into clinical practice in certain departments? Not necessarily. Certain departments look at nurse practitioners as, oh, they're nurses. No, we are nurse practitioners as well, where we are able to make clinical decisions. We can assess and we can diagnose and we can treat and we can prescribe and order any diagnostic testing. And a lot of times in the medical centers, the nurse practitioners are not doing nearly that. Unfortunately, some nurse practitioners are being hired as administrative assistants, to be quite honest. And that's really a shame, not just for the profession itself, but also for the department itself, because access to care is a major issue, especially in New York City and especially within this medical center, where patients just can't get in soon enough. And the answer that I always say during my operational access meetings and on-board meetings is that nurse practitioners are the way that we get our patients in. We are the way to, and I've heard feedback that said from physicians saying that, you know, we don't want to be known as a nurse practitioner-led institution, and we don't want patients to turn away because they think they're seeing the doctor and they're not. And that's not the case. And that's not what we are saying whatsoever. And so there have been some lively conversations there and I had to bring light to the fact that nurse practitioners are not being equalized. They're easily able to see patients in a timely manner. They can see acute visits and then also have the patient follow up with a physician if needed and if they choose, because once they see the nurse practitioner, they often choose to stay with the NP. And allow physicians to see new patients while the nurse practitioners can continue to monitor and to support the medical care of these patients.
Can you talk about how you've been able to influence that at the medical center through your leadership and inclusion?
We're having these conversations, and I think that no one really brings it up and during the board meetings or these operational meetings because no one really understands what they're doing. It's so physician focused. And so
But you're a member of that board.
Yes,
You are at the table.
yeah, and so now we're talking about it because one main issue is that the compensation for advanced practice providers in general at Columbia is not to market rate. And so there's a big push on how do we get there? And there's been conversations since the summer about how we are going to get our providers to market rate. And with that being like, you know, the nurse practitioners who may not be performing to the full scope really should be encouraged to practice to their full scope to make it worthwhile and make it more meaningful to the medical center in general. And we've gotten very good feedback across multiple board members. They actually support it quite a bit. And I think mostly because they see that the retention rate is so low and the attrition rate is so high, and they're seeing that how it's affecting their numbers and their access, and they're really supportive of this initiative.
More questions? Comments? Yes,
And I think this institution.
can you speak up because you got people online?
This institution is, position. Because when I worked as a practitioner in Newark, I was, oh God, in the early 80s, there was much more acceptance of nurse practitioners in the early 1980s in an institution in Newark than I would see when I was doing my doctorate over here. I'm not saying across the board all of them, but it is a challenge for nurse practitioners. It is very much physician.
And it's all departmental based. There's no unification across all departments based on like what department does what and what resources they have and what they can do, which makes it unfair and creates like a competitive environment within our own institution. So we're bringing up these conversations, bringing these to light across the board to say that, you know, we need some unification here.
And yet when they talk about growth, they think about expanding their nurse practitioner growth across all the clinics. So
Can I just follow up on
Yeah,
the theme
absolutely.
of being at the table in general, because I think that's so important. And I think one of the things when we think about students that we're preparing is to have them have the competencies
Yes.
to be at the important tables. And sometime you're at the table a long time before you get to the dessert and what you're really working
Years.
for. But I think it's so important. And I've been both, I guess, very privileged to be at the table during this research chaos time at Columbia, but to be part of the Provost Strategic Research Priority Group. And we are the smallest research intensive school at the table, but it's been so important to be there along with the other very large schools who have way more, a much higher number of researchers in it, but be able to bring our voice, which often offers a different perspective. And I think that's true. We see that in all of our, even our most junior researchers in the research division are already at important tables. I mean, Billy Caceres and leading a statement on SGM and cardiovascular disease. Veronica Barcelona was on a National Academy of Medicine consensus committee that reviewed women's health at the NIH and had a very powerful voice in that work. So just the importance, regardless of whether we're talking education, research, practice, industry, making sure that our our faculty and the people we graduate have the competencies to be at that table. And one of the things that we'd like our alums to help us with, if there are important tables that you think we should be at and we're not at yet, please get us invited to those tables. And once we're at the table, we'll know what to do. We'll know what to do, but sometimes we need those invitations to get to the table, and you
No,
can
we'll be
facilitate making that happen.
Be very helpful. One thing I will say about our students, our students are very different. They come and they are ready to change the world, and they are communicative. They have other degrees, but they don't know how to express that in a fashion that would get them at the table. And we really shepherd that, and we help manage that expression so that they can be effective. So I think the other great thing about Columbia is the people who select to come here. They're different. They want that great education. They could go in their own state. They could probably go and online. They could do anything, but they choose to come here, I think, because they want to be at those tables. They want those voices, because it's not easy to come to the city of New York. They come across the whole country to be here, but they come for a reason. And we hope that when they leave, that they have everything that they need to be able to challenge and support health where they are. And that is not an easy thing for the students or the faculty. You can imagine this is a complex, interactive journey of growth and tug and pull, and it is never dull here. You are not going to be educated to pass NCLEX. In fact, if you want to make any one of these faculty upset, you talk about that. We want to create that professional that is the best of nursing. And I think we can accomplish that, but it's not easy. I will tell you, it's not an easy journey for any of us. And I'm looking at people and I'm thinking of different journeys that we've had along the way, but you have to have a committed faculty who want to make that journey and who don't take this as just an 8 to 5 job, but they are passionate about what they do. They're passionate about the students. And I would say that I've seen this not just at the School of Nursing, but at all schools at Columbia and with all deans at Columbia. So I think, it's not just the School of Nursing, it's the environment in which we exist on that makes us so special. Anything else? I'm going to close it. If you have other questions, please bring them up. I know it's kind of awkward, particularly if you happen to be a student. You probably don't want to ask a question, although I'm pretty sure you'll find a way to ask, and the person that you need to talk to when you're here today. So I guess closing up, what we have, I hope, introduced to you all is that leadership begins and it ends with being human, right? Even what we do, no matter what we do, I'm looking at Nicole at HR, everything we do is about being human. And that is the center of what we do and part of our mission. I want to thank you, the panelists, for being here today. Ashaki Charles and your committee, thank you. Sharon, everybody that helped pull this together, thank you for that. There's coffee and treats back there if you want them. January, we're going to have a virtual session. And then in March, we're going to be gathering in Midtown. So stay tuned. It's going to be nice. And we're going to talk about cardiovascular health. Ruth, you'll probably be up here then. And of course, we hope to see many of you all on April the 24th for alumni weekends. So I hope that we all leave today to carry this spirit that we're finding together. And I know we have, this is, I talked about the faculty, but I didn't talk about the staff. And I didn't talk about all the other people that make this journey in this school what it is today. We have the best staff of any school at Columbia University, and we appreciate all of you all. Every student that comes into this building, they touch base with everybody.